2, 3, 4, 5, and number 6. And we have note cards.
Okay. In today's society, we are very self-conscious over our health. We change our diets. We have soy milk, almond milk versus regular milk. We have veggie burgers versus all-American beef burgers. And people bike and walk to work other than driving for their exercise. There's many things that we can prevent ourselves from, but there's one thing that we can't, and that is breast cancer. Today I'm going to talk to y'all about breast cancer. It is a very widespread disease, illness, that I think a lot of people don't really know about, they hear about. And today I want to talk to y'all about not only the diagnosis of it, but the treatments and the effects of it. Your targeted women vary for different reasons. According to the Northeast Mississippi Daily Journal, breast cancer is the leading cause of death from women 35 to 54. Another thing that I think women need to watch for is a history of breast cancer. If you have relatives that have had breast cancer, you need to be aware that is in your bloodline and check yourself and watch out for it, which leads me to early detection. A big thing that doctors will tell you is the number one way that you can nip this in the bud is to do your self-exams. And I don't think that women take that seriously the way that we probably all should. I know I may not, even though I probably should. And another one is mammograms. It's something that as women, we need to do yearly. And we need to listen to our doctors when we tell them our history. For instance, me, I have a history of breast cancer. That's something I probably would start earlier than others. I think knowing your self-checks and knowing how to do your self-checks and knowing when to get your mammograms and knowing who you're, where you may be targeted if others aren't, is a very big lead in this fight that people have. But a big important thing that people need to know is the treatment that comes with it. It's the treatment and side effects of it. Chemotherapy is a large fight in cancer. Breast cancer is in many cancers, all cancers. Web News Wire says that women who even present stage 2 or 3 breast cancer have great results after chemotherapy. Some of them never even need a mastectomy from it. Another thing that comes after chemo, even sometimes before, is radiation. It's another step in the process. It's a process. Some women choose, to do their chemotherapy and just have a mastectomy. Others choose to do more rounds with the radiation and the chemo where they can do just a lumpectomy, where they will not lose their full breast. They will just lose the tumor and the tissues around it. Again, some don't have choices. They have to stick with their mastectomies. I think the biggest thing that people don't see and don't think of when you think of cancer, if you've never known anybody with cancer, is the side effects of it all. And it's not so much just emotional, but it's the physical. It's the sickness, the days in bed, the fatigue, the loss of your body, as it seems. And ABC News reports that studies have shown, instead of taking medicines and over-the-counter pills, that acupuncture has been a great alternative for women, for fatigue, for nausea, for pain. I think at these points, women get tired, anybody with cancer gets tired of putting in these toxins in their body, and it's a great alternative, something more natural for people to try. The biggest thing that I've seen in my family is, I wouldn't say depression, but the way that it is mentally on you. And, like I said, chemo brings on hair loss, it brings on the fatigue, it brings on the hurt and the pain. And I think that's something that I've watched people in my family go through. And I think if people were more aware of this, to have a support system for their family, and just let them know that you're going through this fight with them, and that you're there with them. You'll go hold their hand with them through treatment, do whatever you can do for these people. It's a great morale booster. I think it's something that doesn't make them feel that they are alone in the fight. You're there with them, and you want to make sure that they feel supported and loved, and you can do anything you can for them. I honestly think that sometimes is better than medicine. So, for me, having such generations of cancer in my family and watching it firsthand, I feel like anybody that can learn a little bit more, educate themselves, take care of themselves, the more knowledge somebody knows, the better they have a chance at. Not everybody will be affected by breast cancer, but at the same time, people need to know that it's there and you can be affected. Even if you don't have one family member with it, that's something you cannot prevent. So I'm hoping with the knowledge that we pass on, the one self-exam at a time, maybe it can save somebody's life the way that it saved my mother's.